This video is to demonstrate a PICC line dressing change. The same procedure can be used for a central or a portacath. One of the primary things you need to remember is that this is a sterile procedure. So before you perform the procedure, get yourself set up. Make sure that you can have a clear table with all your supplies ready beforehand, that you could reach the garbage. Your hands cannot go below your waist, and you cannot turn your back to your sterile fill. So get yourself all set up. Tell your patient beforehand what they need to know. So I'm going to have you put on this mask. You put this top part over the top and pinch it over your nose. And you give patient care, good hand washing before I do patient care. I don my gloves. We're going to loosen this bandage, pulling it towards the insertion site. I use my hand to anchor so I don't accidentally pull it out. Sorry, kind of pulls on your skin.
You could also use some adhesive remover if you have somebody with really hairy arms.
Okay. So now that I have it rolled up and ready to just take off easily, I want to make sure that the line is secured, so when this is released, it does not pull out. So if a piece of tape is not already present, put one in place here. Now I'm going to take off my dirty gloves, use some hand sanitizer. I'll open my sterile kit. Now that I'm ready to become sterile, I'm going to put on my clean glove and remove that old dressing the rest of the way. Okay. To clean for 30 seconds. And you need to let it dry thoroughly before you put your dressing back on. Once it has dried, you're going to apply your bio patch. It is a standard of care, but it does not come in all kits. So check your dressing change kit beforehand, and if it does not open or it does not come in your kit, you can open it beforehand onto your sterile field before you put on your sterile gloves. So here's my bio patch. If needed, you can use your basically tweezers to help get it to go underneath the tubing so it wraps around. That way you can keep sterile. Now it's covered, they can remove their mask. You'll use your pen to document the day this was done. Oh, and then secure the line for fresh tape.
And sometimes the dressing in general needs to be secured like around the sides with just some regular tape.
You're not sterile anymore.
Yeah, you don't have to be sterile anymore, so. Talk about how often they should be changed.
So these should be changed every 7 days or as needed. So if a corner peels up, then we would need to change that. Don't need to wait for the 7 days to wait to change it. And then if you see any fluid, a little bit's okay, a scant amount. Any more than that, then we would need to notify the doctor, and we'd be assessing for signs of infection, monitoring heat, any further redness, the type of drainage, odor, and fever in your patient.